So we'll move through the training fairly quickly. And this is just an overview of what we plan to cover, and some of the sections I'm going to have to go through a little bit quickly, but this is our journey and our training. I just want to mention that we do tailor this training and do other versions of this training to fit with different types of opportunities that you may have to do this training with your organizations, with your communities, with your members of your organizations. Excuse me. So actually, we do have a poll that we wanted to launch. You can go to the next slide. Let me see if I can do it. I apologize for my coughing. Okay, so we did want to let you all answer how familiar you are with paid family leave, so we could get a sense before we embark on the training. Go ahead and answer that. And as folks are answering the poll, I'm going to take a drink of water. Okay. So I'm going to go ahead and give you just an overview so we're all on the same page of what paid family leave is generally. So yes, as makes sense, it is wage replacement, replacing part of an employee's wage while they are on leave so that they can afford to take leave. And the idea is so that people can put their health and their family's well-being first, so that they can care for their loved ones, bond with new babies, adopted, and foster children specifically. It can include one's own health. So when we speak of paid leave in broad terms, usually we'll include the term or the word medical when we talk about taking it for your own health. But still, the majority of people that are taking family leave are taking it as new parents, as it provides time for infant-parent bonding and social support. It is important to note that we're not solely talking about parental leave, and I'm going to get into those nuances in a little bit. But thank you for everyone who did complete the poll. I'll end it and share the results so folks can see. We got a mixed bag. Some folks who aren't aware, others who have some but may be confused, and then others who are somewhat familiar, and a couple of you who are very familiar. No one considers themselves an expert, but hopefully by the time we end here, you will. All right. So go to the next slide. So the reason that some of you may not have heard of paid family leave or be really familiar is because the U.S. does not have a national paid family leave policy. As you can see in this map, U.S. is the only high-income country without a national paid leave. And there's really only 6 countries in the world that have no national paid leave, and that sometimes changes, actually. But we joined the ranks of Papua New Guinea, Suriname, and a handful of other Pacific Island countries that actually don't even show up on the map. 186 countries offer paid leave for new mothers, and 174 offer paid leave for one's own health. And then, of course, most countries in Europe provide really quite long leave. So we are really falling behind as a country. Next slide. What the U.S. does have is FMLA. And this has been around for 32 years, but it's just job protection when workers need to take leave if they're eligible for 12 weeks. It's not paid, of course. So many workers, and especially workers of color, are not able to access this unpaid FMLA leave. About 44% of workers overall are not covered by FMLA because of the eligibility criteria, and the rate is again higher for workers of color. Among workers who are not protected by the FMLA, nearly 0.6 million each year need leave, but they don't take it because they fear losing their jobs. This does also impact lower income workers disproportionately because they can't afford to take leave without wage replacement. They only have this job protection. So even if they are covered, FMLA doesn't help them at all. Next slide. But of course, in New Jersey, we are unique, and we were the second state to pass paid family leave after California, and our program has been around for nearly 16 years. There are currently 13 states and the District of Columbia that have a paid family and medical leave program that has passed, and some of them are actually implementing it this year. Next slide. I want to provide folks with a little bit of background on how we actually came to have New Jersey's paid family leave program. As you all maybe have heard, that we believe policy for people can be created through collaboration and coordination, and of course, coalition building. The coalition Time to Care that we mentioned before has been around for actually over 20 years, working with parents, advocates, small business owners, testifying, passing paid family leave in 2008 and earned sick days in 2018, and then expanding the program paid family leave in 2019. And so folks know how quickly time passes. The baby in the picture there is my now 6-year-old. So next slide. But it's just important to kind of acknowledge and recognize that, if you can go to the next slide, these policies are in place because of advocates and workers sharing their stories, sharing their lived experiences, and that's really important. And that you are all welcome to join the effort. Marching Diamonds and Garden State Equality, who are on our panel, have been involved in the coalition, and we are continuing to advocate to improve access and make our programs accessible to all. So yeah, there's the link there. We'll share with you again in our slides in follow-up. So before we go into the details of what paid family leave provides in New Jersey, I just want to echo some of what Shakira and Lauren and Nat kind of brought up, and the idea that paid leave is a health equity issue, and it's actually related to the concept of social determinants of health. Paid family leave can affect a lot of different areas. So when you have access to paid leave, you're more likely to have these things in the first part of this flow chart. Right. So increased income, social support, time for bonding, time for self-care, and that can lead to the things in the next section. And all these pathways together can have the potential to improve child and maternal health outcomes. And then if you don't have access to paid leave, there's these ripple effects that contribute to the lack of access to having postpartum care, physical and mental health support, the ability to even find and access safe and affordable childcare. So these are aspects that we don't always immediately consider, but we need to think about paid leave as having this positive effect on these broader social determinants of health. And for those of us who care about the health of the folks that we serve. Next slide. So Shakira really did go into this a bit, and how paid leave and the research and some of the research that they've supported can help improve outcomes for pregnant people and babies. But there is a lot of evidence supporting how paid leave can improve maternal, physical, mental health by allowing birthing people to recover from childbirth and adjust to their caregiving responsibilities and addressing their own health needs. About half of birthing people report experiencing pain within the first 2 months following childbirth. Makes sense. Like having a baby, is a significant physical experience. And many of birthing people experience serious, potentially life-threatening postpartum complications. And the added stress and pressure of thinking about how to afford to take time off or having to return to work can really make those factors more significant. So it just makes sense that birthing people who take leave are less likely to experience negative health impacts. And in addition, postpartum depression. And those experiences are real and shown to be evident in a lot of the research looking at this. One of the research outcomes from ACOG identified that ACOG is the American College for Obstetricians and Gynecologists. They found that increasing access to paid leave was a key strategy for ensuring that birthing people can attend postpartum visits and get the care they need. So they have been coming out in support as a really important agency that's looking at the importance of these health outcomes for birthing people and their babies. And I did link here some of the research and how it's contained in one report around all these health outcomes. In the next slide, I just wanted to show you some of the evidence around the paid leave impact on the maternal mental health. And the Center for Disease Control and Prevention, their PRAMS, that's the Pregnancy Risk Monitoring System, found that women who took paid leave, that birthing people who took paid leave following childbirth were less likely to report depression. And this is really evident here in the different stages of recovery: pre-pregnancy, postpartum, and then newly diagnosed, if someone is diagnosed with postpartum depression. So having access to paid leave really does reduce that risk factor. And this next chart is just a visual. Again, the same research also found that there is this disproportionate access to paid leave. 49% of pregnant people who were employed during their pregnancy took some form of paid leave following childbirth. But a significantly larger number of white women were able to take paid leave after giving birth than Black and Hispanic women. It's not in this chart, but also women or birthing people with lower incomes reported taking unpaid or no leave at all after giving birth than birthing people with higher incomes. So we do see this disproportionate impact on who has access. But in terms of the other benefits of paid leave, want to also just highlight that it actually is good for employers. We do hear from the business community often coming out and not in support, saying that there's a cost to business. But actually, when you look at the research, you see that paid leave can retain workers, their attachment to the labor force, and reducing the employee turnover costs. So actually helping an employer or business's bottom line. It also will reduce the long-term workforce disruptions. So the impact of being left out of the workforce for longer periods of time and having to find work, it does impact overall workforce continued involvement. And then it offers time for parents to arrange for stable childcare. If they can't find that, then it's going to mean their disruption in being able to return to work more stably is more likely to happen. And it can support employees' health and lower long-term healthcare costs. Also evidence around boosting workforce morale, productivity, and job satisfaction. And then, of course, just the idea that workers can achieve a better work-life balance. Next slide. And there's a lot of additional evidence. I'm not going to unpack it because it really is quite a lot around, not just the birthing person and child health, but also engagement by fathers and other non-birthing partners and building the stronger relational ties that they have. And then also addressing the racial and gender inequities in health in the workplace and in earnings, and the idea that strengthening families' economic well-being does strengthen the overall economy as well. So a lot of this is common sense, but a lot of the research is supporting it, and we want to make sure to share that. Okay, so let's get into it a little bit. So really, the law around paid family leave was established, again, to offer workers partial wage replacement, but it can be really confusing. One thing we just want to always mention is that family leave is not FMLA. A lot of people conflate those. FMLA is job protections, and I will talk about that in a little bit. But in New Jersey, we have two paid leave programs. Essentially, we talk about paid family leave, but we also have paid medical leave, and that's temporary disability insurance, or TDI. And then the paid family leave is called family leave insurance, or FLI for short. So we're going to first unpack and talk about what family leave, or FLI, provides. So workers use family leave insurance when they need to take leave to bond with a new child, cope with domestic or sexual violence, and also to care for a loved one. So those are the main areas. And the next slide, we'll talk about bonding. So bonding is important to understand for family leave. This is not maternity leave, as we mentioned before. Bonding leave is for both parents, birthing, non-birthing parents, same-sex parents, adoptive parents. Any parent of a child can be eligible to take up to 12 weeks of leave to bond with a new child, birth, placement, or adoption, again, in the first year. So really, it's not about the identity of the parent, whether it's the mom or the dad, it's any parent. All right. So next slide. So in terms of taking leave to cope with domestic or sexual violence, this was part of the expansion in 2019. And this was not just for the individuals themselves who are coping with those issues, but also for those who are caring for their loved ones who are coping with these issues. And they can take family leave to seek medical attention, therapy, victim advocacy, legal services, recovering at home, seeking safe shelter, and more. So really any issues related to coping with domestic or sexual violence. Next slide. And in terms of using family leave insurance to care for a loved one, workers can use this to care for any loved one who has a physical or mental health condition. This is usually more serious health conditions that are certified by a healthcare provider that require some amount of recovery or healing. Next slide. Part of the expansion was to broadly define who is a family member. And the law now says it's any family member or individual who's considered to be family. The technical definition is any individual with a close association equivalent of a family relationship. But the law also does explicitly list out child, spouse, parents, siblings, grandparents, grandchildren, in-laws, any blood relation, as well as chosen family. As we talked about before, this is really important for LGBTQ plus people and also people with disabilities. Often they are disproportionately, they need to rely on loved ones instead of blood relations to care for them. And so this is a really important piece of the inclusive family definition. New Jersey was really the first state to pass this. And so we want to make sure folks know that they can use it to care for anyone who they define as family. Next slide. So who is eligible? It's important to understand that in New Jersey, most workers are covered in the family leave insurance program. It's not just a few select folks. So really, if you are an employee in New Jersey and you are with a valid Social Security number, family leave insurance is available with a few exceptions. Federal government employees, they have to see what is available to them. Out-of-state employees, faith-based organization employees, and workers who are not technically employed and are considered independent contractors. Sometimes people are misclassified, so that's important to make sure that someone is actually exempt from being considered an employee. But this is the broad majority of workers in New Jersey who are, in fact, covered by family leave insurance. In terms of qualifications, to be eligible, you do have to have met minimum gross earnings in about the year and a half before you take leave. So this is where kind of the rubber hits the road in terms of the details of who is eligible. It's about what you've earned, though, not about how long you've worked at your employer or how many employees there are at your employer. So for 2025, you have to have worked 20 weeks, earning at least $303 in those 20 weeks, or you can look at your combined total of earnings in about the year and a half before you take leave. That's considered the base year period, and that's $15,200. That is quite high for some workers who may have just entered the workforce or have been working part-time, and we are actually advocating to change the eligibility criteria, but currently that is the standard for being considered qualified to receive these benefits. Workers are contributing in their payroll taxes to the program, so it essentially is their money. Next slide. In terms of what is available, the timeline, there are 12 weeks of benefits available if you take them consecutively, or if you break it up, you can take 56 individual days or 8 weeks. This is considered intermittent leave, and this is available every 12-month period. And the benefit provides for 2025, this adjusts every year. You can go to the next slide. It's 85% of your average weekly wage, and the maximum for this year is $1,081 a week. And this is something you'll make with the average weekly wage at any employment that you have. So all your earnings will be calculating this percentage. Although depending on how much you earn, you could hit that weekly cap of 1,081. But there are delays in claims and the ability for folks to get paid. And this is an area we're also advocating for change so that people can receive their benefits quicker. The next slide, we're actually going to talk briefly about temporary disability, or TDI. This is, again, the medical leave. So for your own health. The eligibility and the benefits that I already described are the same for temporary disability as they are for family leave insurance. This has been around actually since 1948 in New Jersey. And this is sometimes when you use the term maternity leave for somebody who's taking it as a birthing person, this is actually the program that will cover your wage replacement. So you can see here in the middle, pregnancy and recovery from childbirth is one of the reasons that somebody could take TDI. But it's really any physical or mental health condition that a healthcare provider can certify that someone cannot work, that you can take disability for. And that includes gender affirming procedures here. Next slide. So just some of the basic details around temporary disability insurance. It's available for up to 26 weeks a year, as long as you have the medical certification from a healthcare provider. And the exemptions are a little different for temporary disability. Federal employers are exempt completely, but county and municipal employers are not required to participate. So many of their workers, that includes public school teachers or other public school staff, are not necessarily participating in disability, but hopefully the employer has let folks know and that they should have potentially purchased a private plan, which is always an option that someone can do. But in terms of the state benefit, it does cover the majority of workers that are not exempt, as described here. Next slide. So just to give you a little bit of an overview of the steps for the birthing person when it comes to taking paid leave. They would take temporary disability benefits first if they're covered. Typically, that's 4 weeks before your due date or when a doctor can certify the disability. And then you just go online, myleavebenefits.nj.gov. That's the Department of Labor. They oversee the benefit program. You submit a claim there when really you stop working and you're not getting paid from your job or full pay from your job. An employer can pay the rest of your salary since the wage replacement is partial. But if you're receiving full benefits, if your employer does offer any type of paid leave, you're going to want to wait until you're not receiving full pay. And again, your doctor says certified that you're unable to work due to the pregnancy. And then after disability for someone's recovery, which is typically 6 to 8 weeks after they deliver, depending on their recovery timeline, they can access bonding. And that's family leave insurance again. And they can really do that anytime before the baby turns 1, but a lot of new birthing parents do take it immediately following disability. For the non-birthing parent, they would actually be applying anytime after the baby arrives, before the baby turns 1. Okay, and the next slide does just give you a link to the Department of Labor's maternity timeline tools, what they call it. And it does help folks outline the calendar for what they might be looking at when it comes to taking leave. So that's a helpful resource. And I'm coming up on time, so I'm going to move a little quickly here. But I just want to let you know that there is a lot of information that we think is related, benefits and programs that are helpful for folks to know about. And when I mentioned before, FMLA is not the same thing as family leave insurance. This is a big part of confusion. If you can go to the next slide. And the next one. So the FMLA and the New Jersey Family Leave Act, again, this is different than family leave insurance. These are the laws that explicitly protect a worker's job when they're on leave. But it is still illegal for an employer to retaliate against an employee when they are trying to take their benefits, and an employee has the right to take private legal action. So that's important to note. In the next slide, which I'm not going to have time to go into detail, but again, we'll share these resources and follow up. This is also a link where you can get more information about the distinctions between paid leave eligibility criteria and job protection criteria, because somebody could be eligible for paid leave and be able to take the benefit, but not have access to the job protections. And that's important for folks to understand what, what is important to them in thinking about taking leave. And then in the next slide, there's a really helpful flyer here about the Division of Civil Rights overseeing of the Family Leave Act. And this is the state law that protects workers' job for caregiving and bonding. And so this is a really helpful flyer that we like to share with people. And in the next slide, I did share detailed information about the law against discrimination, which was mentioned earlier in the panel. These are really important protections and really are very comprehensive anti-discrimination laws. A range of protected classes from disability, race, religion, natural origin, nationality, gender expression, identity, sexual or orientation, pregnancy, breastfeeding. These are all identities or experiences that are protected, and employers must treat workers equally and cannot treat people differently based on any of these statuses. And so this is a really important protection to know about. The Division of Civil Rights in New Jersey oversees this law, and if someone has questions or concerns about if they're being discriminated, that's the agency to turn to. And also in the next slide, again, this will be available to everyone, but the law against discrimination was expanded by the New Jersey Pregnant Worker Fairness Act, which does require employers of all sizes, doesn't matter the size of the employer, to accommodate pregnant workers. And that could include the right to job protected leave as well. So if someone doesn't qualify for job protections under FMLA or the New Jersey Family Leave Act, they might want to look at if they're protected under this law as well. As I sort of wrap up here, I just want to say, one final thing for Know Your Rights in the next slide is the Earned Sick Leave Law. This is an important law that covers all workers regardless of immigration status. An employer must provide at least 5 paid sick days a year. It doesn't matter the size of the employer. And that can be used for any of your own health needs as well as caring for your family. And the employer must pay the worker directly for that minimum amount of time. And then we did want to share a little bit about some of the barriers the gaps that exist in terms of accessing paid leave. Some of it we already kind of unpacked. Awareness, understanding, and then of course fear. And the fear is related to really losing your job and the ability to take the leave without repercussions. And that's an area in which we're working. You can see in the next slide that 1.7 million workers actually don't qualify for job protections under the Family Leave Act. And that's a huge number of folks. It does disproportionately impact lower income workers, workers of color, and New Jersey's really behind in this area. So this is an area of advocacy that New Jersey Citizen Action is working on. If this is something that impacts some folks that you know, please let us know and connect us. We are trying to make access to family leave without the fear of job loss a priority. So I'm going to actually let folks put any questions in the chat, take a couple extra minutes to see if you want me to address anything now while I'm live. And then now if we could launch the poll, see if folks learned anything, even though that was really, oh, sorry, this was the poll from before. That was a really fast training. Wanted to make sure that we ended not too much later. Let me see. I can launch it, I think. There we go. So how familiar do you feel with paid family leave now with that whirlwind of a training? Do you feel like your knowledge expanded a bit? And maybe if we send you the slides and the recording and you can go over those, you will feel even more confident in your understanding. Okay, so I can see I don't know if any of the questions were asked that didn't get answered. Do we want to try to address?
Yeah, and I'm also just to let everyone know, I'm gonna stay on for a few minutes after this to just note down everybody's questions. But let me try to scroll to the first
Yeah, we
question.
understand if folks have to go. This was the time frame that we set, but we will stick around for folks that want to have their questions answered live. Okay.
Yeah, so I'm seeing
So,
what can we do or give undocumented families who can't even qualify for benefits like paid leave or can't access healthcare due to fear, cost, or other factors.
well, first, it's important to know that all children are eligible for the NJ Family Cares, regardless of their immigration status. So, just that's important to make sure that our families know. And as I mentioned in the concluding part of the presentation, which I'm sorry it was so fast, is that earned sick leave is available to workers. The employers must pay that, or it's considered wage theft. They can file claims with the Department of Labor if they're not being paid for any of their sick time. The other protections that are afforded to workers, regardless of immigration status, are those laws around discrimination protections. Also, the laws around leave, it's regardless of immigration status. And also, we are working so that anyone who is able to contribute, being paid, with a paycheck, is able to access the benefit regardless of having a valid Social Security number or not. So that's something that we are advocating for. So let us know if you want to get involved in that effort. But for now, it is limited in terms of undocumented immigrants not being able to access those benefits, except for the earned sick leave and job protections.
Yeah, and I'm also seeing when you say available every 12 months, does that reset with the calendar year or 12 months from the first day of your previous leave?
Yeah, it's from when you've taken leave. So it's based on your own timeline of when you've taken leave. So the state will essentially like restart the benefits that are available to you after your leave, after you've taken leave again. So it is a problem in terms of job protection under the Family Leave Act specifically, because that's actually only available every 24-month period. But in terms of FMLA job protection, it's every 12-month period. The benefits are available every 12-month period.
Great, and yeah, I'm seeing a few folks just asking if this training is going to be shared out after to just to confirm with y'all that we are recording it and we will send out the recording
Yeah,
to
and in conclusion, Nat, if you can go to the next slide, just I don't want to hold. I hate always going over time, but we wanted to at least cover these. One of the things we always make the case for, if you work with communities, if you work with families, you really are a conduit of information, and that's really where people are understanding what's available to them is actually through in conversation with real people like yourself. So if we can do, and you can go to the next slide too, if we can do anything to support your understanding, your staff, your coworkers understanding, we will do that. So these are some resources. We will come to you and do trainings if you need. You can use the referral one-on-one guidance link, as well as if folks have stories they want to share, and if people want to get e-action alerts, they can sign up for those there. And then there's also a set of materials that is available on the Department of Labor's website. These are materials that, if you go to the next slide, they're digital, but also the Department of Labor will mail out copies of at least 100 of any of these flyers or handouts. You can see them on this link here on this slide.